All right, I just hit broadcast then.
And I'm going live on Facebook.
Okay. Thanks everybody for being here, and sorry for the technical difficulty this morning. All right, Savannah, you just let me know when we're ready.
Okay, it's on Facebook now, so if we want to give it maybe 1 more minute or so.
Yeah, that'll be good.
Tyler, are you the one that's going to introduce us, or is Dr. Landers going to start off?
Yes, I'll introduce everybody and kick it over to Dr. Landers, and then she'll give her opening remarks and roll it through to you next after that.
Okay, very good.
Okay, I think we're ready to go, Tyler.
All right. All right, well, good morning, everybody, and welcome to today's joint news conference with the Alabama Department of Public Health and the University of Alabama at Birmingham. Today's GuideSafe news conference will provide an important update on the GuideSafe exposure notification app, which began its pilot testing on August the 3rd. The app was built by UAB and Birmingham-based Motion Mobs in conjunction with the ADPH and integrating both Google and Apple's ENS. Alabama is one of the first states in the U.S. to launch Google and Apple's joint exposure notification technology. So this morning we'll have opening statements from Dr. Karen Landers, District Medical Officer for the ADPH, Dr. Kirk Carver, UAB's Chief Information Officer, and Dr. Sue Feldman, Professor of Health Informatics and UAB's School of Health Professions. We will also have time for a media Q&A session immediately following the opening statements. So please raise your hand in the Zoom application and we will call on you for your question at that time. And with that, we'll begin with the opening remarks from Dr. Landers.
Thank you, Tyler. And thank you so much, Drs. Carver and Feldman, for being with me today as we discuss this useful tool for the general public in the fight against COVID-19. The Alabama Department of Public Health, in conjunction with UAB and Motion Mobs, and in integrating this exposure notification system, which was developed by Google and Apple, is proud to announce the GuideSafe notification app statewide. And as of today, any individual can download this app at no cost to their Apple or Android device. This is an exciting day for all Alabamians, and we appreciate the support of Governor Kay Ivey for this initiative being funded by the CARES Act in order for us to put this into place in the state of Alabama. Alabama is one of the first states in the United States to launch this joint technology to the general public. And we are thrilled to be among the first to bring this to Alabama for you and your loved ones. This tool will arm us with the power to inform ourselves regarding potential exposures to COVID-19. And this will be done safely and securely. And this will be an extremely powerful tool for us in combating this virus. We know that from our numbers, since we began reporting COVID-19 in Alabama in March of 2020, that we now have, as of yesterday, over 108,000 cases of COVID-19 in Alabama, as well as 1,892 unfortunate deaths. So these numbers show us that we still have a long way to go in this fight. But by having this tool, having this notification app, this will help us very much to control the spread of this virus. And we cannot stress enough how vital it is for all Alabamians who are able to do so to download this app, because we must work together to defeat this virus. We must work as individuals and we must work as a group in order to be successful in our efforts. We must be stronger and we must be smarter. And this app will allow us to be just that. So with this information, I would like to turn this over to Dr. Carver, who can tell us more about the functionality and security of the GuideSafe app. Thank you.
Thank you, Dr. Landers. We're excited to be at this point where we can offer this technology to all Alabamians as we continue to work together to mitigate our risks during this pandemic. I'd like to also thank Governor Ivey, Dr. Harris, Chancellor St. John of the University of Alabama System, President Watts at UAB, and Senior Vice President Selwyn Vickers for their strategic foresight and decisive leadership during the development of the exposure notification app. It allowed us to create this highly secure digital platform that truly empowers the people of our state. As Karen mentioned, we started this project way back in March and April as one of the earliest Apple-Google partners in the nation. That really would not have been possible without their support and their trust in our ability to deliver on the behalf of the citizens of Alabama. So thank you. I'd also like to recognize literally the thousands of people who have contributed to the project. What started out as a conversation between Dr. Feldman and I back in March and April quickly grew into a collaboration between ADPH, UAB, the Birmingham-based company Motion Mobs, Apple, and Google, with faculty, medical, technical, marketing, and public relation experts all directly contributing to the project. Last week, more than 1,800 beta testers around the state worked to test the app and make sure that everything was working as intended. This really has been an amazing team effort that leveraged the collective intellect and creative energy of a large team intent on saving lives. And I'm humbled to be a small part of the Alabama team. I'm going to discuss some of the features and functions of the app we evaluated, which will become apparent as Dr. Feldman walks through the app. The first is we tried to make the app easy to use for the citizens of Alabama. Cell phones using the Apple or Google operating system account for 99% of the cell phones in the United States. This makes a partnership with Apple and Google a natural choice. Their use of low energy, Bluetooth, and ability to work in background were also compelling from an ease of use perspective. We want everyone in Alabama to be a hero, to use the app, and thus we tried to make the app as easy as possible. A secondary feature is the GuideSafe exposure notification app complements and strengthens ADPH's efforts to accelerate notification of possible exposures. This app does not replace ADPH contact tracing, but instead augments their life-saving work by using the power of technology to notify those who you do not know or cannot remember coming in contact with, even before the health department reaches out to you after a positive test. The app was also designed to strenuously protect personal privacy while anonymously alerting users of possible exposure to someone who later tests positive to COVID-19. Data confidentiality and user privacy permeate every aspect of the app. Here are kind of 6 key points I want to share on how the app essentially works. Once the GuideSafe exposure notification app is downloaded to an iPhone or Android device, users will opt in to the notification system through a few simple steps. The apps went out in the Apple and Google stores last night. The app never records location, identity, or accesses your contact list. It does not use GPS technology. Let me say that again. The app never records location or identity or accesses your contact list. It does not use GPS technology. Instead, the app generates a random code for every user phone. The random code then changes every 10 to 20 minutes to preserve security. As users go about their day, all phones utilizing the Alabama GuideSafe exposure notification app that are in close contact, defined as within 6 feet for greater than 15 minutes, of others will exchange these random codes via low energy Bluetooth. This exchange works even if the app is in the background, so users can continue to use their phones for other tasks. When a self-reported and lab-verified positive COVID-19 test occurs, ADPH enables notification of all phones through a random code matching process using the last 14 days of data. Apple is not involved. Google is not involved. UAB is not involved. The state of Alabama is not involved. The federal government is not involved. It's an encrypted notification between the Alabama Department of Public Health and you about a possible exposure through the app. If there is a match, the GuideSafe app will notify the user and facilitate assistance from ADPH, as well as point users toward other tools in the GuideSafe platform. Now for an example of how the GuideSafe exposure notification app works, I'd like to turn it over to Dr. Sue Feldman.
Thank you very much. And so what I'm going to do in a moment is I'm going to layer on what Dr. Landers and Dr. Carver said on actual use of the app. Before I do that, I want to highlight something that Dr. Landers said. She said individuals and a group. So this involves every one of us as individuals and everyone as a group. Before I share my screen and start showing the app, I would like to also acknowledge a true collaboration between UAB leadership, ADPH, the UA system, and the state. I contend only at UAB can something this great happen in such a short amount of time. So now I'm going to share my screen. Okay, and so you should see the GuideSafe app there. Okay, and so I'm going to take a couple of minutes to run you through the GuideSafe exposure notification app and how it works. In the process, I will cover what it does, but more importantly, I will cover what it does not do. Once the app is downloaded from the Google and Apple markets, the user selects Get Started. As Kurt mentioned, the primary reason we chose the Google and Apple platform upon which to develop was because of the high regard for privacy. So in terms of what the GuideSafe exposure notification app does not do, it does not collect or store personal information, such as users' names, dates of birth, physical address, or email address. It cannot determine the user's identity or the identity of anyone with whom the user has come in contact. It does not in any way access the user's contact list on the phone or connect with any social media accounts in any way. Lastly, while other apps on the user's phone may already be collecting location data, the GuideSafe exposure notification app does not collect any location or GPS data. The user's phone, the user's location are not tracked in any way. So what it does do is that it uses low energy Bluetooth signals to exchange anonymous and encrypted codes, which are stored in your phone's operating system until a time within 14 days when a potential exposure occurs. Only at that time are those anonymous and encrypted codes released with the user's permission, but they are never attached to the person as the user. So next, the user confirms that they are over 14 and they have read the privacy notice. And as mentioned, the user gives permission for the actual exposure. Let's see, why is it not?
You have to click the buttons.
Yeah, but it's not going forward in the way that it should. So let me just stop sharing for a moment. I apologize for that. And let me, sorry about that. Let me see if I can get that to work. There's a button on the bottom that's supposed to advance it, and it's not. So let me.
While Dr. Feldman is working on that, let me jump back in here and just remind you to please raise your hand in the Zoom application. And once we're done with opening remarks, we'll be able to have a quick question and answer session also with the media. Just once you raise your hand, Savannah will call on you and enable your microphone so that you can speak. Just please identify who you are and which organization you're with when you ask your question. We'll resume here in just a moment as soon as everything's ready to roll.
Yeah, I figured out what the problem was. So let me share my screen again. Okay, hopefully now I have it. Okay, there we go. That's the button I'm looking for right down there. Perfect. I apologize for that, and thank you for your patience. Okay. Okay, there we go. So now we're back on track. So as I mentioned, the user gives permission for the actual exposure notification to be released. So this screen right here is the powerhouse behind the GuideSafe exposure notification app. In that, when, let's see, let me go back one, this one right here. In that, when the user enables exposure notifications, they are notifying people sooner in the notification cycle, thereby decreasing exposure time across their immediate close contact population, as well as those not so immediate. In many cases, alerting people who the user does not know or does not remember, and that is the powerhouse behind this. Close contact in this regard, as Dr. Carver mentioned, is considered to be when two people, or in this case, the phones, are within 6 feet or fewer for 15 minutes or longer. Next, this is the home screen where the user reports a positive test. Updates settings, connects to Health Check, the GuideSafe ongoing symptom and exposure web-based application that is being used in schools and colleges across Alabama, and connecting to the Alabama Department of Public Health for education information. This screen also tells the user up on top when the app was last checked, when it last cycled for exposure checks. When I looked at my app this morning, it gave a list that I could see when it was last cycled. And mine looks like it's cycling about every 4 hours. So next, by checking the exposure checkbox, the user can see how many exposures they've had in the past 14 days, and mine shows up here, no recent exposures. This is what the screen looks like when there's been at least one exposure within the last 14 days. And then there's guidance with a request to go back to GuideSafe's Health Check to log in for symptoms. By going back to GuideSafe's Health Check to log any symptoms, the user gets access to specific guidance from their campus or business. This is one of the unique features of how the two applications work together. Okay, so next we're going to talk about how to report a positive test. So from the home screen, the user will select Report Positive Test, and it results in this screen right here. Next, the user indicates the date of the positive test. Since currently the tests take at least 24 hours to get back, this would likely be a date that has already passed, and then the user continues. Next is the novel and innovative feature of how UAB IT, and in particular, Rajesh Pillai and Brian Rivers, has built into the validation system into the GuideSafe exposure notification app. Absent a way to validate a truly positive COVID-19 test, there's opportunity for nefarious activity. In other words, people reporting positive tests and sending out erroneous exposure notifications that are not linked to any real actual tests. So there has to be a way to validate that someone is truly reporting a positive test that ADPH has notification of. By law, labs must notify ADPH within 4 hours of a positive test. So the delay here is going to be at least 4 hours. But let's talk a little bit more about how this happens. So first the user puts, oh, that's not what I wanted to happen. Sorry about that. So first the user puts in their phone number. Let me get back to that screen here. Okay, there we go. So first the user puts in their phone number. The phone number is only used to be able to send the user back a text code, and then the phone number is destroyed. So think of this a little bit like two-factor authentication from your bank. The user then inputs that code into the green box on top here, the code that they got in the text message. And here is where the magic happens. From that phone number, the system creates a hash, which is a one-way cryptographic method for being able to store information without storing the actual data that was used to create the hash. In this case, it's the user's phone number, which you may or may not remember, I said, is destroyed once you get that text message. So in this case, the system stores the hash or the one-way cryptographic code in escrow or a holding container for later potential matching with an identical hash or cryptographic code created from a positive lab reported test to ADPH. Once these matches are made, notifications go out to all anonymous encrypted codes that the phone has been collecting over the last 14-day period. After the user submits the positive test, then they are finished. So thank you very much for being patient with me while I walked through that demo.
You bet. Thank you very much, Dr. Feldman. All right, so with that, we can move on to some questions now. Just again, as a reminder, if you do have a question, raise your hand in the Zoom application. Savannah is going to call on you and enable your microphone. And then once again, also please identify just who you are and which organization you're with. Thank you very much.
Okay, hold on one moment. Melissa Brown, you may ask your question.
Hi, thank you. I'm with the Montgomery Advertiser. Please correct me if I'm wrong, but my assumption is obviously this app, the notification system, would be much more effective if, say, 10,000 people are using it versus 1,000. Do y'all have a threshold or a percentage of Alabamians that you are wanting to meet, or that would make this sort of, sorry, I can't really think of the word, but the most effective, or is there something, if you aren't able to hit that goal, that would make this just not as effective as you're hoping to in terms of being able to do that contact tracing and informing people of possible exposures?
So Melissa, I think the question that you're really asking is about critical mass. And so I'm going to answer it a couple of different ways. I think there's critical mass in a small group, and then there's critical mass in larger groups. And what we hope is that when these small groups get together, is that everyone within those small groups will have downloaded the exposure notification app. And then people go to another group, and everybody in that group downloads the exposure notification app. And then they go to another group, and everybody in that group downloads the exposure notification app. And before we know it, we will have a critical mass across the state, but that critical mass must start with smaller groups. So if you imagine everybody in a fraternity or sorority house, okay, everybody in that group should have it downloaded. If you imagine going to an event, let's say a conference or something like that, we would want everybody in that group to have it downloaded. And before we know it, critical mass will happen on its own. Kurt, you may have something additional to add to that.
Yeah, obviously we want everyone to use it if they can. For the universities across the state, it's highly encouraged but not required. But the more people that use it, the more powerful it is. We're all in the middle of a pandemic. And as Sue started, it's time for all of us to fight this pandemic and to use technology. As long as it's running in background, it will do its work. It will only bother you if there's a positive notification. And it complements the excellent work that ADPH is already doing with formal contact tracing. So our hope is everyone will use it. All you've got to do is install it, enable it, and you're done. It will do the magic for you.
Thank you, Melissa. Morgan Hightower, feel free to ask your question.
Hi, and I just have one question of clarification, and then I have a question that I would like a little bit more detail on. So for the pilot program, you said it was 1,800 people who were participating in that. During that period, do you know how many exposures were sent out, or was it not long enough for that 14-day period to work? And then was there anything learned through that experience? And then just the second part about the phone number and how it connects with ADPH. Is it important for users to give their testing site the same phone number that they're going to be giving the app, so that way it can be matched? I'm just curious about people who might prefer to use their phone number, their home number when they're doing medical related things versus their cell phone number.
Yeah, those are good questions, Morgan. I think the answer to the second question is, yeah, the phone numbers need to match for the verification algorithm to work. And you're going to have to remind me of the first question. It went into short-term memory and went right back out.
Hold on one second. Let me make sure she can talk. Morgan, do you want to re-ask that question?
Okay, yes. Thanks, Savannah. So this was just about the pilot period. Were you guys able to find any notifications or exposures? And if so, how many?
I don't know about the notifications. I think the second part of your question was, were there adjustments made to the app based on the 1,800 users? And that was almost daily. So every day people found small things, the 800 volunteers around the state that we were able to add to the app. Sue, I'm not aware of any exposures.
There was actually one that was officially made, and we don't know about if there were any notifications because we don't have any visibility into that. But we do know that there was one true exposure reported, or one true positive test reported.
Okay. Lauren Walsh, feel free to ask your question.
Yes, Dr. Landers, we have seen the numbers statewide go down. If we see a large amount of Alabamians participate in this app, do you expect those numbers to go down further, or how do you expect this app to have an impact on COVID-19 spread through our state?
Savannah, am I unmuted now?
Go for it.
Okay, good. Thank you, Lauren. And of course, we are certainly seeing those numbers decline ever so slightly. And we do know that the measures that we have put into place, such as the social distancing, the respiratory hygiene, and the safer at home order that Governor Ivey put into place several weeks ago, appears to be having some impact. I think once we have this additional tool, this will provide us the opportunity to be able to have another enhancement, if you will, to contact tracing. It's very, very important. This is not a contact tracing app, but it will allow us information related to knowing who has been exposed, as far as persons being aware of potential exposure, and therefore being able to take measures to protect themselves as well as to protect others from transmission. So I'm very excited about having this additional tool as an enhancement for a way for us to let people know of potential exposures. Thank you.
Thanks, Lauren. J.E. Adams, feel free to ask your question.
Hey, sorry, Jesselyn Adams, and I'm with CBS 42 News. So my question is, I know several universities are already planning on using this. So y'all are saying that even businesses, like everyone, should be using this app.
Yes.
Yes.
Go ahead, Sue.
Yeah, Sue, do you want to go ahead and answer that one?
Sure. Yes, this is available for everyone and should be used by everyone. Now, there's a couple of limitations that it's important for people to know about. It needs a certain level operating system on your Android or Apple device in order to run. And so we don't have any control over that. It's just a function of the way Google and Apple built the application for us to develop on top of. Many people may notice that if they go into their settings, and then depending on what kind of device they have, they will notice something that already says exposure notifications. That has been included in an operating system update to your Apple and Google phone, to the operating system, in order to allow this app to work should you decide to download it. And as I mentioned at the outset, and answered a question earlier, and Dr. Landers mentioned this as well. It's important for us as individuals to take responsibility in how we can mitigate all of the effects and the escalation of COVID-19. If we all do our part as individuals, then the population happens automatically. It's when we don't do our part as individuals that the population has gaps towards the mitigation and spread of COVID-19. And so it's going to start with each of us individually, whether we're a student, whether we're a parent, whether we're a business owner, worker, a member of our community, to download the GuideSafe exposure notification app from the Google and Apple markets and to just let it run in the background. As Dr. Carver mentioned, it just runs. It doesn't impact anything. You don't have to see it. And then if you have a potential exposure, it sends a notification just like all the other notifications that you get on your phone. So it's really no different than that.
Thank you. All right. Okay, Alan Collins, feel free to ask your question.
Okay. Yes, this is Alan Collins with WBRC Fox 6 News, and this is for Dr. Landers. She talked about numbers going down. I want to get her react to the improvement on the state map, which is now low to moderate, which is far more so than it was a month ago, bleeding red. And do you think masks is the chief reason why? Or do you have any concerns? Schools returning and a need for stronger enforcement?
Well, Alan, we know that the measures that we put into place are only as good as the adherence of everyone to those measures. And I think we have to build on what each of us has said this morning, and that is an individual approach and an individual responsibility. And that includes this exposure notification app. Again, it is an individual responsibility. You know, I do think that the adherence to the Safer at Home order and the adherence to the mask order has been very useful in seeing numbers go down. My concern at this point in time is, as we have seen counties really have an improvement in their overall picture, if you look at our risk dashboard from Friday, my concern is that as we see some improvement, persons will want to relax the standards, and this is not a time to do that. We have to remain consistent. We have to remain vigilant. We've seen some improvement. We need to continue to do what we are doing to have that improvement to, again, continue. And as I said, hopefully have those numbers decrease. And just having this additional tool is another way that we as Alabamians can fight this virus. This is what we have right now until we have vaccine or better treatments. But again, prevention is absolutely the key. Thank you.
Okay. Dallas Parker, you can ask your question.
Hey there, Dallas Parker with WHNT News 19. I have an initial question and one for clarification as well. My initial question is, are there any age restrictions? Do you have to be 18 or over? Because, of course, teens are some of the people that are still gathering right now outside of schools. And then that follow-up is just, can you further explain how the positive tests are being validated between ADPH and the app? Because I know you kind of touched on that a little bit, Dr. Feltman.
Sure. So yes, there is a minimum 14 years old age requirement. And so that's the requirement to be able to use the app. In terms of your second question on how, how does this all happen? So, so when you input your phone number, it takes your phone number and I'm going to oversimplify this, but it scrambles it into something that can't be unscrambled. And then it deposits that into, like, think of like an escrow account or like a container, and it just sits. That's all it does, is just sits there. Then somebody submits their positive test. The lab submits somebody's positive test to ADPH. That same process happens at ADPH. When those two scrambled, they're not totally numbers, alphanumeric codes, match, then there's information that's sent out to the phones, and the close contact information that's held on your phone, and remember that's 15 minutes or longer at 6 feet or fewer, then that's released from there. So I tried to oversimplify it, but I will say that it's this notification validation system that was developed right here at UAB by Rajesh Pillai and Brian Rivers, has been receiving quite the national attention, and so it has been applied for a patent because of its uniqueness, its novelty, and its innovation.
Great. Before I take another question, just a reminder that we're here today to take questions about the GuideSafe exposure notification app launch. So let's try and keep questions geared towards that if possible. I think I just saw WTVY had a question, but you lowered your hand. Oh, there you are. Feel free to ask your question. WTVY, do you have a question? Okay. Do you have a question to ask? I'm going to move on if not. Okay. We're going to circle back. I think people have already asked questions, have some follow-ups, so we'll go back from the top. Morgan Hightower, feel free to ask your question.
Thanks, Savannah. And this might sound like super Captain Obvious, but once a person gets the notification that, or the notification that they might have been exposed to someone else, what is your recommendation for that person to do?
That's a great question, Morgan. And built into the app is guidance from ADPH on what the person should do. And so we have all of that education built right into the app. And that's one of the nice things about it, is they don't have to go out to the website. They can if they want, but they don't have to. Everything is self-contained right there.
Great. All right, Lauren Walsh, feel free to ask your question.
Thank you, Savannah. You touched on this, on how contact tracing can help with people that you remember, but can you elaborate on how this app can be helpful? Because I can't tell you everyone I talked to 2 weeks ago. So can you kind of touch on how this can be a helpful tool to help more people know when they've been exposed?
Yeah, Lauren, that's probably the superpower of this app, if you want to think about it that way. The app is exchanging those codes and the phones are remembering those codes. So you don't need to know someone's name or location. You don't need any of that. The phones are actually doing it for you in the background. And that information, it holds that information for about 14 days. And just like verification, just think of it as a unique alphanumeric identifier that's changing every 10 to 20 minutes. But the phones are keeping track of all of that. And then when a positive test case is verified, ADPH can enable the matching. And again, because we don't know your name, we don't know it, none of that information, we don't know your location. All we know is those two codes match, which meant that you were within 6 feet for more than 15 minutes. And we had a large number of medical experts at UAB, at Alabama Department of Public Health, at Google and Apple that collaborated on, what actually we want to use for our measure. We looked at what the CDC was doing. But again, that's the beauty of this app. We want to protect your privacy. We're doing it in such a way that we don't record any of that personal information. We're just generating codes and see if they match after a positive test case comes in. Did that answer your question, Lauren? Because it really is at the heart of this. And it's why we want everyone to use this. If you just turn it on and leave it in background, you're not sharing any personal information, and you're helping protect all of those around you.
Great. Thank you, Kurt. That was helpful. Okay, I'm going to take a question from Amy with AL.com.
Hey, can you hear me okay?
Yes.
Okay, great. This is Amy from AL.com, and I guess my question is, since I know there's a lot of confidentiality built into this app, will ADPH have access to any of those contacts that the person has made that they may not remember to give to the contact tracer, or will they not have access to those?
They don't have access to that, Amy.
Okay.
That information is not shared. Again, it's an individual choice to report, and it's a individual notification. It's an encrypted conversation that's taking place when that notification takes place. And so, no, that information is not provided to ADPH. Now, the individuals do go to or have the opportunity to go to ADPH's page on what actions they should take, and that should help facilitate and accelerate protecting the population. But the short, simple, direct, blunt answer is no. That information is not shared.
All right, thank you.
And the thing that I would like to add to that, it's not shared because it's not collected. And so when the phones are next to one another, encrypted codes are what are stored in each person's phone. So none of the personal information is even stored, so it can't be shared because it's not ever collected. And that's the important part. When you think about data collection along a continuum, you have to actually collect the data to share the information. If the data are not being collected, there's no information to share.
Yeah, and Sue made this point earlier, and it's a really important point. It's stored encrypted in the operating system. Even those codes that are encrypted are not inside the app; they're inside the operating system itself, which adds another layer of protection. It's a really good question, Amy.
Thank you, Amy. All right. Going back to the top of some people who are asking questions for a second time, Alan Collins, feel free to ask your question. Alan, do you have a question? Okay, we're going to move on. Dallas Parker, feel free to ask your question.
Hey, just one more question for you all. In terms of, we talked a little bit about how we confirm, whether it's a true positive COVID-19 case via ADPH, but a false negative. What happens when someone inputs a false negative? Does the app kind of take it away if ADPH doesn't confirm it after a certain amount of time? How does that work?
So again, Sue kind of talked about this or alluded to it. Nothing happens. If you try to go in and try to report a case, you're not going to get without a verification code. It's actually just not going to go anywhere. So you can't go in and engage. I think Sue used the word nefarious. You can't use nefarious activities to go in and cause problems, like leaving your cell phone in a supermarket and then reporting you're positive. It just won't work. The app will not notify anyone. The notification only occurs when there is verification by ADPH. And that only occurs if there's a matching of encrypted, very long alphanumeric keys. And
Gotcha.
so that have gone through a secure one-way hash. So it's again, Sue talked about it. It's the same as trying to break two-factor authentication with your bank. It's that level of complexity to try to break this, and it's just not going to notify anyone unless there is a positive match of these encrypted keys.
Thank you.
Thank you. All right, Jesselyn, if you want to ask your question.
Yes, so I know I brought up, colleges are using these. So for parents of college students who still have concerns about this app, and their child using it and everything, what is your message to them? And, what are the pros of universities using this and preventing the spread of COVID-19 as universities come back in session?
Sue, do you want to take that one first?
Who did you say, Tyler?
Sue. Yes, ma'am.
Okay. All right. So the thing that I would say to people in our community, whether they are a child with a cell phone, whether they're an adult with a cell phone, just anybody in our community, in school, out of school, at a business, not at a business, there's no one silver bullet that is going to be the be-all, end-all to end COVID-19. It doesn't exist today, doesn't exist tomorrow. We don't know if and when it will ever exist. We have a flu vaccine, we still have flu. So even with a vaccine, there's a likelihood that we will continue to have different mutations of COVID-19. So when you think about what I just said, that there's really no one silver bullet, then you have to pull back from that and say, all right, well, what is available that we have kind of in our arsenal? Like, what are the tools in our toolbox that we can enact right now? And what is our power over being able to use and utilize those tools properly? So there's a few things, and Dr. Landers mentioned most of them, right? There's being safer at home. There's wearing masks, and I will add, wearing masks properly. That means a covering like this, not a covering like this. That means social distancing, staying 6 feet apart from one another. That means washing our hands. That means being smart about where we go and how we're going there. So what does that mean? I mean, we can unpack that a little bit. That might mean making sure that we have the exposure notification app downloaded, because that is a tool in our toolbox. There's a health check, which is now implemented in most, if not all, institutions of higher ed across the state and some K-12 schools. That's also available for businesses as well. And so while the CARES Act money, and we are so fortunate for Governor Ivey and her support in the GuideSafe platform, that helps get us back to school. That's one community in our larger community of being an Alabamian. What about the rest of our community? What else can the rest of our community do to look at these tools in our toolbox and then execute them properly, appropriately, and consistently? So I hope that helps.
If I could, that was awesome. If I could complement that or augment that a little bit, I think when you're talking to students, it's best to give them a couple of vignettes and allow them to understand the power of this app and the power of being responsible. So let's start with something near and dear to our heart. Do you want to go to a football game? If you go to a football game, you need to have this app downloaded. Do you want to go to a concert? You need to have this app downloaded. If you go to an Alabama football game and there are 100,000 people in the stands and 10 people are positive, do 100,000 people go on quarantine, or do you use the power of the technology to know who was actually close to the 10 people? That is a compelling argument. Download the app, turn it on, and just leave it alone running in background. It takes nothing. Download the app, be a hero, and download the app and add it to your arsenal of tools to save others. And I use the example of football, but you could also talk about a class. If you've got a large class and you look at UAB or Auburn or University, all of these schools, we're trying to social distance in the classroom. But if you have a student that comes up positive and it happens, do you quarantine everybody in the class, or do you use the power of technology to only quarantine those that had possible exposure? And so it's just so simple. Please download the app. Please use let it run in background. And if I sound slightly impassioned, right before this meeting, I got notified my sister now has COVID and is running a fever, and my deputy in a previous job is in the hospital right now with COVID. And so the tools like health check, tools like the exposure notification will allow us to accelerate decreasing the spread of this virus, so that your sisters and your deputies and colleagues that you work with do not come down with this virus until we get a vaccine or until we come up with better mechanisms for coping with us. So be a hero. That's what I would tell students. Be a hero. Do the right thing. Download the app and just leave it alone.
Thank you, Kurt, and Sue as well. Looks like we've only got one question left, one hand raised. So we'll take that from Morgan with Fox 6. If there's any other questions, feel free to raise your hand. If not, we will look towards wrapping up after Morgan's question.
Thank you, Savannah. And Dr. Carver, I'm sorry, I hope your sister gets well soon and your friend. I hate to hear that. This is just a follow-up to something Dr. Feldman said earlier about the patent that you have taken out for a certain aspect of the app. Can you talk about just a little bit more information about the reasoning for doing that, and then the potential for future use of that technology, maybe in something bigger, as you were talking about just how long-term the situation is that we are currently in?
So I think whenever you whenever you find a novel and innovative use for something, the natural progression is to patent it. And in technology, that's the same as it is in other domains as well. And so that's just a natural outgrowth of being able to have a novel and innovative use for something. And then, can you repeat the second question, the second part of your question? I'm sorry.
Yes, I was just wondering if there was any future plans for patenting the technology, if maybe you could see it used in other applications. That I was just kind of thinking a little bit down the road.
Yeah, absolutely. So, so I will say that the UAB is the only state, the only one who's developed this for a state that is using the validation, as having the validation done in this way. There are other states that are actually using humans to validate the tests. And so, you know, so when you think about that, we really wanted to be sensitive to the work that ADPH is doing and the work that they need to do, and not to be able to take away from that work. And so it makes sense to be able to have these two systems be able to accomplish something without human intervention. And so I think as we go forward, we are looking at doing this in a national environment as well. Right now, it's just in the state of Alabama, but doing this in a national environment on the national server, we will have to have a mechanism for validation there as well. And so we hope that we will be able to deploy this in that environment also.
All right, thank you, Morgan. Thank you, Sue. With that, we're going to conclude the Q&A portion of this news briefing. I'll turn it over to Tyler to wrap up with any final comments.
All right. Well, thank you, Savannah, and thank you, Dr. Landers, Dr. Carver, and Dr. Feldman for taking part in this today. And thank you, everyone, for joining us for the statewide launch of the GuideSafe Exposure Notification app. Please do visit www.guidesafe.org for links to both the Google and Apple stores to download the free app. A news release with additional details, including those links, was distributed to you during the news conference today. If you did not receive it, please feel free to reach out to Savannah, me, or Ashley Fulmer at Big Communications, and we'll get it over to you quickly. Also, additional information on the GuideSafe platform is available at www.guidesafe.org. That also includes a digital media room with graphics, photos, and B-roll and interviews. Just so you're aware too, we do plan to hold a news briefing on Thursday at 3 p.m. to provide an update on GuideSafe entry testing. So be on the lookout for that communication as we get closer to Thursday. So thank you again for all you're doing to keep the public informed during the pandemic. We greatly appreciate each of you and all of your contributions. Everyone have a great week.